Welcome to Almost Here, Round the Corner Future Technology podcast with Richard Jacobs. Future technologies poised to transform our lives for better or worse are the focus of this podcast. Almost here means these technologies are now here and starting to be used, or just around the corner, from Bitcoin to artificial intelligence, 3D printing, blockchain, virtual reality, and more.
Hello, this is Richard Jacobs with the Future Tech Podcast. Interviewing another speaker at the Metabolic Health Summit coming up early next year. Her name is Dr. Barbara Royal. She's a DVM and a founder of the Royal Treatment Veterinary Center. So, Dr. Royal, how you doing?
I'm great. How are you?
Good. Yeah, I'm glad you're here. So tell me about the Royal Treatment Veterinary Center. How is it different or unique from other veterinary care clinics?
Yeah, the Royal Treatment Vet Center sort of started not really on purpose. I never intended to run my own clinic, but I was working as a conventional veterinarian and had studied acupuncture. And the more I learned about different types of holistic practices and nutrition and trying to avoid vaccinations, doing titers, things like that, the less able I was to work in a conventional practice. It just became harder and harder to, recommend things as usual or deal with the food that was being sold at clinics and things like that. So I started my own practice really just so that I could practice the way I wanted to practice. And what was so interesting about it is I was very happy being a veterinarian. I always have wanted to be a veterinarian since I was 6. So I had no real interest in, becoming a leader or doing half of the things I've done, writing books and teaching and everything. I just wanted to be a veterinarian. But once I had the clinic going, I had so many people coming and people wanted integrative medicine. They wanted to look at other options other than just pharmaceuticals or surgery, or, they wanted to think about diet and think about the causes of health. So I found suddenly there was this reputation that, I'm this integrative practitioner. So I had veterinarians start to shadow me or technicians start to come and they wanted to see what I was doing and learn about it. Or it was so interesting to me. I was like, wow, people really do want to do this. And all of a sudden now it's 4 doctors and 25 employees. And, I had a group of veterinarians from Japan come to, follow me around during the day. And I was doing acupuncture and different things. I felt like, I feel like I should be the one following them because they've been doing acupuncture a lot longer than I had. But it was just, putting it all together and making it an integrative program, I think is what they were so fascinated by. So,
well, I think in most professions, I think in most professions, like 99% of the practitioners are just your standard off-the-shelf practitioners. And, when I've asked them about alternative treatments, for human-type stuff or dog-type stuff, they may even be aware of it. They go, oh, yeah, we don't do that. And then I think, well, why don't you do that? And they, we just don't do that.
And it's tricky because it's very hard to learn about. I mean, it's not an easy thing to get information, to get correct information. I mean, I studied, before vet school, I studied chemistry and I studied English both, but the science part of my brain really needs to know that it makes sense. I didn't want to be, I didn't want to be known. Even when I came out of vet school, I was like, I'm not going to be one of those, crazy holistic practitioners. I don't want to be that. I wanted to have respect in my field. I wanted the science to make sense. And I wanted to have some backup in terms of, that this has been evidence-based, well looked at, and very effective methods. And for me, I just want to use what works because I love the animals I treat. I have no interest in doing things to them, with them, or give them things that are not going to make them healthier. So it's definitely been interesting because part of my problem was finding ways to learn about this stuff, which is one of the reasons I ended up opening my own university so that I could actually teach this and it could become business as usual. This is how we do medicine. We focus on causes of health first, and then we deal with the things that maybe as a doctor we might have to do, from pharmaceutical, surgery, herbal medicine, acupuncture, whatever else we've got out there to use.
So I've been to traditional veterinary places, and then I've seen, like, in Beverly Hills, they'll have massages for dogs and things like that. But, I know this is not that. This is actual health stuff. Not that massages are wrong or bad, but, I've seen, like,
Yeah.
Dogs getting their nails done, and they put it in a context where it's silly and not for their health necessarily.
Mm-hmm. It's a funny line that, people did that with me when I first started doing more holistic medicine. I was doing acupuncture, and I had friends or different veterinarians in the area call up and say, you know what, when you first came here and were practicing, we were excited. You seemed sensible, but what's happened to you? Like, you've gone holistic, and that means you're crazy. And there's an image of what that means. It's like we're doing chicken blood in circles, and chanting, or it's crystals and just things like that. But all of those things have some basis in some sort of medicine. So I just looked into what's real, what's effective, and what I can actually use. And I just have to say my biggest success with myself was just to admit that I didn't know everything. And coming out as a doctor, you're sort of encouraged to think you do know everything, and you're the final word. So when you're asked something about what you don't know, it's very confusing about what to do. And it's very difficult to say, wow, I don't know about that. Maybe it's okay. And that was the biggest thing for me. Once I sort of accepted that, yes, I'm a veterinarian. I've been classically trained in conventional medicine. I did very well in school. And at the same time, there's many things I don't know. And I'm willing to learn about them and decide for myself if they make sense, rather than just listen to the hype from, whatever the multi-billion-dollar industries out there want me to hear. And that's the pet food industry, the pharmaceutical industry, and just status quo is always threatened by something new. And I realized I just had to be open and listen and see if it worked. And that's made all the difference in my practice.
Oh, that's great. So what kind of therapies? You mentioned acupuncture. What other therapies do you do that traditional vets won't do?
I think probably the most important one for me is nutrition. And the nutrition that I do is really the basis of every single thing I do. I will have spent at least 30 minutes with every client that comes in just to talk through what they're feeding, how often they're feeding, how much they're feeding, what kind of treats they're doing. So nutrition is really the biggest one. And I know that that's something that does not happen, in most Western veterinary medicine practices, because it's hard. It takes a lot of time, and it's something that we're really not taught a lot about. So I think that's the biggest one. I remember my nutrition classes in vet school. I mean, it was, we had a brief one semester thing that barely touched on dogs and cats, and the Hills and Science Diet people. I probably shouldn't say names. Maybe we shouldn't say that. But it was true that there were big conventional companies that came in and told us about their products. But that was really the most of what we learned about nutrition. We weren't learning about what the requirements were for magnesium, or what the protein and fat and carbohydrate fractions really should be. How does that actually show itself to be helpful? We weren't taught about any of that. And so now I look and I think, wow, I had studied nutrition before I went to vet school, because I worked in zoos. And in zoo medicine, you can't do medicine without knowing about the diet for each species. And in fact, it is the first line of defense for all of the animals that you're dealing with in wildlife and with zoos. Is you have to think about their nutrition first, because if you don't get that right, you'll never be able to heal them. And you very often don't even know what kind of medications they can tolerate. So that was a big awakening to me, to go, oh, I really need to go back to that training, think about the species, what they do in nature, because that's really the basis of all health. This planet has this incredible interconnected web of keeping itself and its occupants healthy. And if we pay attention to that kind of interaction, and the metabolics involved, how the systems work together, and try to provide that for animals in our care, we see way more health starting out. And then maybe, again, we have to deal with being a doctor or something like that, but it's a much easier job. And I know that's one of the
is paralleled probably exactly in medical school for humans. Very little on nutrition, if anything, and the influence of various companies. So it sounds exactly the same.
Yeah, and and I understand the companies are there. They're doing what they're doing, and they're trying to sell their food and make, they're judging things based on money and all of that. I understand that, but my job is really different. My job is to judge things based on health. What do I see? And so now I've got over 20 years of watching animals eat themselves healthy. And that's my job. I'm not going to be swayed by somebody telling me that they think this is a better way to go if I don't see it actually happening. And I think part of the reason why in veterinary medicine, the suicide rates are the highest of any profession. And I think that's because, for me, when I was 6, I wanted to be a veterinarian. I wanted to make animals healthy and be involved with animals. I loved them so much. And that excitement and interest has never left me. But I can imagine if I were a conventional practitioner and I didn't have the tools that I have, I would be very, very sad every day because I would be feeding foods that are, inappropriate for the species. I would be seeing these diseases chronically come back and back. I would be seeing the high rate of cancers and allergies and arthritis and obesity all the time and feel that I'm really not being very effective. And I think that would be very hard on my soul. And I can see why people would despair. In my profession as an integrative practitioner, I delight in going to work every day. I get excited about every case and I think, wow, here's another chance I can make an animal better. It is very satisfying. And I know that's quite a difference from the way that the world must be, because why would we have such high suicide rates otherwise?
Yeah, that's crazy. Well, so you start out with a nutrition consultation. Makes total sense.
Mm-hmm.
It's sad that zoos take better care of animals than people take care of themselves, and animals take care, vets take care of animals.
Yeah. Mm-hmm.
So in addition to this nutrition, what are some of the therapies that you provide?
Yeah, so we'll do so many different things and choose the thing that's going to work the most. So it's either acupuncture, chiropractic, herbal medicine. It can be Western herbal medicine or Chinese herbal medicine. I've studied all of those things in different places. I've been to Tufts to study Canada. We've done rehabilitation therapies with animals. I've got 2 underwater treadmills. We have laser for inflammation, for other treatments. We have massage therapy that you mentioned earlier, which, it is true. You can get a ton from massage therapy. I see that is one of my most effective therapies out there. And it is also, the source of a lot of sort of people joking about holistic medicine and massage, because there is that other aspect of it. It's like, we're pampering and catering to our pets in an unseemly way. For me, it's the same thing. I agree with you. We're talking about taking these more natural therapies and using them as an effective tool, rather than having to go to a pharmaceutical that will have side effects and things like that. But I don't really see it as pampering pets, because for me, the more I do natural healing, the more I do things in a natural way, the less we have to do for these animals. They get to live with us in a very healthy way without us constantly having to be taking care of them. So my goal for the owners that come to my practice is maybe we'll try all these different therapies. Maybe they'll do the rehab. We'll get them healthy. We'll get the nutrition right, and they can do less. Then eventually these animals are going to be on their own autopilot with their ancestral tools to heal themselves intact. And then it's just, you get to have an animal in your life to bring joy and to go and play with them and feed them. And that's all you do. That's my goal, is to interact with them and live with them. And everybody gets to be healthy in the end.
Well, I don't know if you've seen this phenomenon, but the healthier that I eat and my wife eats and my kids eat, the healthier that we bring our pets along with us. And that phenomena happens if you help someone's pet's health, that maybe the pet brings the person along with them and improves their health too. It seems
Absolutely.
Like if getting healthy with your pet works really well.
So often that happens. Just starting down the path of thinking about the causes of health, it's sort of eye-opening for people, because we tend to think, it doesn't matter, I can cheat, or I can eat this, or I can do that, and if I want to eat a lot of processed food, so be it, it's still food. Well, the fact is, food really should mean something to us. It should actually be something that matters. We're putting it in our bodies. So we should be thinking about it. It shouldn't be cheap. It shouldn't be cheap. It shouldn't be quick. It can be quick. I've definitely eaten food in my car when I'm in a hurry. But I think what I would like, my owners to think about when they're dealing with their animals is people say, oh, but for $30, I can buy a bag of kibble and feed my Great Dane for a month. And I'm like, that's really interesting, but what are you feeding them? What is that? How can that possibly be good? Because you're feeding an animal, it's meat. So that means some food animal somewhere has to live and then be slaughtered, be properly processed. The meat has to be stored and put into something where it can finally eventually get to the animal in good shape. And how can that possibly be so cheap? If it's that cheap, then someone's cheating somewhere. Somebody is treating an animal badly, or somebody is adding a lot of filler, or somebody is doing something that doesn't make sense. And we shouldn't think of it that way. We should think of it in terms of, I want to keep my animal healthy. I'd rather spend money on excellent food and also love the food animals that feed my animals. I'd like to stress that part of it, because those animals shouldn't have to suffer. And then not spend so much money on pharmaceuticals and surgeries and things like that we routinely do. And it's the same. People start to think about that, and then they look at their own lives and they say, wow, I'm significantly overweight and I'm arthritic and I can't play with my grandchildren. And, all of these things are happening, and I feel like it's just my condition rather than my choice. And sometimes there's addictions to sugar, and same with cats and dogs when they're eating kibble food. It's, 50% of most kibble foods is sugar. They get addicted, they get obese, get them off those things. And people start to see that in their own lives, and they go, wow, we got my dog off of sugar, got him onto a really healthy diet that's appropriate for that species, and look at him running around, and he's 12 years old and had cancer before and now doesn't. And like, this is amazing. And, I've seen that. I've definitely seen that. And so I see people, I've had a couple that came in to me who both of them were pretty significantly obese, had grandchildren in, 4 states away, but couldn't get to them, never saw them. And they saw what happened with their 12-year-old dog, who got thin and energetic and just was adorable, and came in pretty much, they said, last legs, we're going to see what we can do for the last couple months of this dog's life. The dog lived another 4 years, and they did the same thing with their diets. They lost, I think, between them over 110 pounds and became incredibly healthy. That was within the first, couple of months. All of this weight came off, and then they felt like they could hike again. They went and saw their grandkids in Arizona, hiked the Grand Canyon. They did crazy stuff that they were never going to do. And they got a good functional nutrition doctor, and just their lives were completely changed. And it was simply focusing on the causes of health. And they got off of different blood pressure medications and cholesterol medications, all of that stuff. And I didn't do it. They went off and did it just from opening their eyes.
That's really cool. For a while we had an old dog, and my wife she got into bone broth, and she started making bone broth, and we had it, and the dog had it. It literally brought him back to life. And he was 12 at the time. He wasn't doing too good, and he ended up living to be almost 16. And he was like a new dog after a few months of that. It was cool.
It's just a little bit of healthy food can go a long way in a scavenger. You don't have to necessarily even change everything. For me, I'll say, okay, I understand. You've got a budget. You already have this animal. Okay, the decision is made. This is all you can do. Then, okay, let's add a sardine now and again. Let's put in some bone broth. Let's do a little bit of goat milk. Let's add an egg. Do these little things to help improve the protein profile in this animal and give them a chance to heal themselves. Change how much you feed, cut the food in half, make them thin and change their metabolism a bit so that they can get a little bit on the, use their ketones appropriately and have a better metabolic function so they can fight cancer and heal a little bit. It is not that difficult to start down the path to health. It's just people feel very nervous about things they don't know about. And for some reason, we have gone away from understanding good ways to heal our own pets, to heal ourselves as well. My grandmother knew more about medicine, I think, than I did when I started vet school. She, they were on a farm and they took care of things. The food mattered. The animals, she took care of the animals unless something really, really terrible happened, and then she would call a vet. And it's just a different world. We have no idea how to take care of ourselves or eat properly or do that anymore. And we're believing all the hype about what we should be doing with us, trying to eat processed foods and all that kind of stuff. That's crazy. It's crazy.
Yeah. Well, in regards to the therapies, massage, I could see why that works. My dogs, make me massage them every day by petting them constantly. But,
mine too.
What about acupuncture and what about chiropractic? Like, I've had chiropractic done on my dogs, but it's hard to do it. Like, unless you anesthetize them, how do you, like, my chiropractor had to do it like real quick, like one quick adjustment, and it helped. The dogs were like, they got all this energy back and they ran around, and one was limping and he stopped limping. But how do you do chiropractic and acupuncture without the dogs like biting the person or moving?
They don't usually, and I've been doing it for 20 years. And I mean, the acupuncture that I do, and I've got doctors who do chiropractic for me. Again, there's no anesthesia involved. In fact, it's going to be less effective if you have to do that. So you are trained as a veterinarian to do these therapies, and the spinal manipulation that they do, things like that. I mean, you have to learn how to do this without causing a lot of pain. And it's the same with people. I mean, I don't go to the chiropractor and expect them to cause me a lot of pain. I'm hoping that that's not going to happen. But, and it's the same, the acupuncture needles, I've done acupuncture on camels, on zebras, on elephants, on, meerkat. I have to figure out and let them know what I'm doing. I mean, the elephant that I did acupuncture on, I had to really work with for quite a while. And it's been the same with even dogs. I've had some dogs, I have to get them used to me sort of tapping on them, things like that, so that they will, and distract them. I'd give them a treat. I'll do other things and distract them while I can put the needles in. But, if you're dealing, when I started, I was doing a lot more zoo medicine. So I'm very used to dealing with animals. And even in the wildlife medicine that I've done, you have to be reading their signs. You have to look at what they're about. And again, that's really part of this healing from a natural standpoint. I don't want to have an animal so stressed out in front of me that my treatment is going to be really minimal compared to the stress that they're feeling. It's not going to work out. I'm just causing them more trouble. I have to work with what is normal for them, what they need. So I'm reading that as I go. With a cat, the cat's in my lap. I'm sitting with them. I'm quietly rubbing around their head like their mama would do, the licking of the face. So they sort of go, oh, this is maybe good. Or, with the elephant, I had to constantly be watching her eye so that if I'm going to stick a needle in an elephant's, leg, you can do that, by the way. Their skin is pretty supple. I can't have her grab me with her trunk and throw me across the room. That would be a bad idea. So I have to let her know that what I'm doing is making sense to her. We've already worked through some of the dance of me touching her and poking a little bit and things like that. And she likes me. She's had treats from me. She's, done all of this so that when I do it, she's sort of like, hey, did you just... And it's like, yeah, I did that, but it's okay. That's fine. And they're like, oh, okay, we'll let you do that. And that's how it is with every species of animal that I work with. I want to get that connection. I want to have it be something that we're doing this together. And it does work better that way. Works that way with animals. So most of the veterinarians that I know have worked with animals that are a little bit difficult. I've had a lot of veterinarians that have, once you've worked with a horse or something that might try to get you, you realize a better way to do that is to start to really understand what they need first before you're trying to just get these treatments in. It's not Western medicine to me, where it's like, at any cost we're gonna go ahead and do these things. We have to take our time a little bit, and that's fine. That works.
You might not want to show the picture of the needle you used on the elephant when you advertise acupuncture, because it would probably scare people.
True. It's a little different needle, that's for sure. It was a lot longer. But again, it's just quietly knowing how to do it and how to work it through. And for me now, the experience that I have has really helped as well. I know certain points are going to be more sensitive than others. I know how to, work my way around that. And then also deciding on when a treatment's working and when it's not. Sometimes it's like, this is not the therapy for you. Maybe because it's not working well because the animal is just too, a lot of terriers tend to be very jittery about things going into their skin, or certain thin-skinned animals or animals with, different types of hair coats. You can tell it's just every time you do it, they're so reactive. It's like, let's think of a different therapy because we have lots of them. or sometimes it's because you realize that isn't actually the best thing to help the animal. Sometimes I'm doing acupuncture, but I realize that if I really could get the owners to change the diet, they would end up spending much less money and solving the problem. Or if I could get this animal into an underwater treadmill, I could get this neurologic function back way quicker than I could with acupuncture. Or, like when I dealt with camels, I was, very quickly doing acupuncture on camels for years. I became, the international expert on camel acupuncture, probably because I was the only one doing camel acupuncture. But, I started to get emails from all over the world from different zoos saying, wow, our camels have terrible arthritis too. What do we do? Can you come and can you show us? And, so I was doing that for a bit, and I suddenly thought, wait a minute, why? Do camels in the wild have terrible arthritis? And it turns out they don't. And I started on a search, and this was many years ago, 15, 20 years ago, where it wasn't Google, so I'm looking in dusty zoo libraries, and I found a little reference to the fact that camels who don't get enough salt get really bad arthritis. And salt is something that, with hoof stock, you tend to put a salt lick out, and they lick the salt, and that's enough, and they get what they need. But with camels, the amount of salt that they would eat in their diet was like 8 or 9 times higher than a normal hoof stock animal would eat.
Oh, wow.
And so you can't get it. They couldn't get enough of it from the salt lick. So they were all suffering from this salt deficiency, and we started adding, browse and leaves and things like that had more salt content and changed their diet. And suddenly all of these problems became much less important to them. They were not dealing with arthritis. They were actually getting healthier and moving around better. And it just became a different ballgame. So, it's knowing the best therapy and trying to use it, knowing the animal, understanding their tolerance levels. Laser is really great because you don't really have to touch them and they can be close by. And it's really effective. It's got great science behind it. It decreases inflammation. We can use laser a lot. So there's all these different methods. It's herbal medicine. It's, looking at different nutraceuticals and supplements. I use a ton of topicals. People forget to use topicals for skin infections, for other problems where you can see if you've got chronic ear things, going to oral medications upsets the GI tract. It messes with things. And I've got the problem right there in front of me on the skin. Use a topical. So, yeah, all that.
How do I've heard from regular veterinarians, people don't want to pay for their animals. They just want the cheapest stuff. People don't value taking care of their animals. I mean, it sounds like it's a completely different experience where you are. Does that come from you? Does that come from the people? You just select better patients that the owners that will spend on their animals come to you, or what do you think makes that work for you?
That's interesting, and it's an interesting question. I find so I'm in Chicago, and my clinic is really in a very blue collar, sort of a day worker, night worker kind of a place. I have clients from the local area. I mean, people will know. Yes, I'm also Oprah's veterinarian, so there's not really a budget there, but that's not my practice. My practice is really a local practice with people from all walks of life. I've got people from, what we call the Gold Coast who drive to me. I've got people from my neighborhood who walk to me. I've got people from other states. So I haven't really selected for people with money or people who are just, willing to spend on their pets. I've got people who, really, they're trying to save money when they're dealing with their animals because they don't have a lot. It's more, I think people recognize they're spending money on things that work. And they're not necessarily feeling like what I'm recommending that they do is going to end up costing them a fortune. And most of my patients say that I save them money in the end because we're going to be using fewer vaccines. They're going to be spending less of their money. When they're buying a food, every bit of it's worth what they're paying for. So you're not necessarily buying a bag of food where it's 50% of what you're paying for is sugar or chemicals or carcinogens.
Right.
Which is in a lot of dog food. So if you know that you're buying food that's going to make them healthy, that's amazing. And you know that then that's going to decrease on the medications, the amount of times you have to be going to the veterinarian. I mean, you go to a veterinarian every time you walk in, it's, it can't be less than $300. And I say, don't spend that money on me. Spend it $300 more on a really great pet food. It's changing the way we think about health, not necessarily spending more on health. And I think if we change the way we allot our money and think, food actually does matter, and this more prevention does matter, avoiding vaccines, not having to do a ton of chemicals and pesticides to avoid, fleas and ticks, and using things that are more natural and not injuring our animals while we're trying to solve simple problems. That is what makes a difference. And my clients really feel that. And I have many clients who've been with me for many years who think that, I've definitely saved them money over the course of their care for their animals.
Yeah, no, that's great.
Yep.
Yeah, it is. It's frustrating. With veterinarians.
People
I've had
do.
some that, some that don't, they can't even handle the animals properly at all. But,
Well, it's just, for me, I don't have, exam tables. We do things on the floor. We try to I think about what the animal wants. We've got half doors. We've got wood on the walls. I try to make it a comfortable place. I make sure that it's absolutely sanitary. My chemistry side of my brain is there all the time. But I recognize, also what people are saying too is, the pet industry in general, it's a multi-billion-dollar industry. Sadly for me, people are spending more and more and more on their pets and just doing, because they can, they do. Like, we're seeing so many things in terms of, medicine. I've had people come to me after having spent $25,000 mortgaging their home, just to do surgery after surgery for a dog that is severely overweight, and they're on their 5th back surgery. Like, this dog has an obesity problem and an inflammation problem that's out of control. The skin's bad, allergies, things like that, infections at the sites of the surgeries, and they keep on doing these back surgeries on inflamed spinal cord without ever addressing the basic problem. That's sad to me. People will spend money. They will mortgage their homes. They will spend their money. They love their pets. And I don't mind that. I don't mind that we love our pets and we want to do that. I'd like to do it in a more natural way and understand you need to get to the bottom of the underlying problems with what's happening metabolically to make this animal have these chronic problems. The body would prefer to heal itself. We just have to give it the tools, and that's what we need to do. And I think in integrative medicine, you have a much better chance of doing that.
Well, very good. So tell me a little bit about the Metabolic Health Summit that's coming that you're going to be speaking at. What are you going to be talking about? And, are you excited about it? And, what's going on there?
I'm very excited about it. The way that I think I'm going to try to approach this is because I know that this summit is talking about the human side, and I'm bringing in really how we approach this from the animal side and why that makes a difference for people. So the human-animal bond is a big part of what I like to talk a little bit about, and how we see ourselves in our animals, and there's a little bit of a difference between the metabolism that's happening to keep an animal healthy versus what happens to keep a person healthy, and then how I approach that, and how we change the way people think about how they're treating their animals. The biggest thing we're dealing with, I think, in this talk is cancer, and how to get an animal to fight cancers, to deal with their own metabolism, where they can tap into the ancestral cleanup tool that will recognize really bad cells, that will recognize mitochondria that have gone off the rails and are starting to overproduce. How can we affect change without having to be dealing with multiple surgeries and chemotherapy and all of that? What can the body do for us first? And there's ways to do all of that together. I have many, many cases of cancer where I'll say do the surgery, remove the big, amount of it, and then let's deal with the metabolics of how the body is, why things went off the rail. What do we do to give the body a chance to heal this before it happens again?
You should do your whole presentation, not even say you're a veterinarian, and talk about your patients and all the stuff that happens. And then at the very end say, by the way, I'm a veterinarian. I've been talking about animals the whole time. And I bet you the audience will be like blown away, because everything you're saying is the exact same thing in humans.
It is.
It's funny,
because these mechanisms in animals and on the planet. Trees have antibacterial capacity throughout their bark. That's one of the reasons I use wood in my practice. That I can culture all around my clinic to look for different resistant things and whatever. I don't get that because I have natural wood that helps me fight what's going on. The wood, even off of a tree that's been cut down, it has antibacterial capacity. So it's fighting disease itself. I'm trying to use in nature, a lot of the things that I see and try to use that. And at the same time, I consider the planet is sort of my largest patient. I want to see this interactive health. So we're not doing, pesticides. We're doing this, my husband and I have an organic farm. I want to see the earth help me keep things healthy. And I want to see that for the food animals that are feeding, the pets that I treat. I want to see it for, every aspect of what I look at. And that is definitely, we're animals, humans, we're not so separate from this planet as we think. It's important that we connect. And that's where I think this animal-human bond is so important. It brings us to a level of understanding where we realize that we are connected and that we can't do everything ourselves. We need to rely on nature to help us.
Would you mind if the last few questions I ask you about cancer treatment for I guess it's dogs and cats, or what kind of animals?
Sure. The cancer treatments that we do?
Yeah, what animals do you see that get cancer? Is it dogs and cats, or other animals, or just dogs?
Yeah, it's many animals, and definitely my practice is mainly dogs and cats. I still consult at the zoos, and I do some wildlife work. I will say that wildlife cancers are not nearly at the rates that we're seeing in dogs and cats. And right now they're saying 1 in every 2 dogs will have cancer, which is an insanely high rate.
My God.
I know, yeah, right. I know when I came out of vet school, I remember thinking, wow, I hope I don't see cancer very often. And my professors are like, yeah, you'll see a few cases of cancer per year, maybe, something like that. And good luck with you, because at that point, there's really not a lot we do for cancer. We can do surgery.
Wow.
There was a little bit of the chemo and things like that, but it wasn't great. It wasn't great. The cats didn't tolerate it well, and it was tricky with dogs. And I didn't see a lot of cancer when I started. Did not see a lot of cancer, and it wasn't because I was missing it. I mean, I'm sort of, I'm the same person. These are big tumors that you can't miss now. I see so much cancer that in the beginning, in my integrative practice, I just was despairing. I just thought, what is going on? And I know now, because in my own practice, my cancer rates are not as high as they are in the general population. So, I really believe that because animals in my practice are eating the way that I recommend that they eat, and I mean, it isn't because I'm such a great veterinarian. It's because the owners are actually taking heed. They are trying to keep their animals healthy before they get to me. So it is, owners on their second pet or third pet, and they're like, oh, we're feeding this really great food. We're, doing the vaccinations that we need. But then after that, we're doing blood tests to prove that they are still immune, rather than constantly injecting them with vaccines and all of that kind of adjuvant. We're doing things where we're not putting pesticides on our animals and expecting them to stay healthy if we do that every month. I mean, I don't put a pesticide on myself when I go in the woods and let it absorb into my neck and into my fat layer. I mean, I'd love to. I hate ticks, but it's just a bad idea. I don't constantly vaccinate myself. I got a rabies vaccination when I was in vet school, and they just, instead of vaccinating me constantly, they check my titers to make sure I'm still immune. So you can't do that. You can't do that legally in this country, because, I mean, for me, I can as a human, but not a dog and a cat. They need to get vaccinated every 3 years, or it's illegal. And that, that's strange. That those laws need to change, and hopefully they will. But for now, we have to do that. Other vaccines, we don't have to do all the time. So for me, the cancer that we're seeing is really high. In cats, they get vaccine-associated carcinomas, vaccine-associated sarcomas, not carcinomas, sorry, vaccine-associated sarcomas at the site of the vaccine. If you give too many of them, and, different cats react differently, but it's a pretty high rate, in my opinion. And that's what we're seeing. Now, the nice part about it is, if you combine therapies and do integrative medicine, we've been really successful at making these animals live long past what would be considered their expiration date, even from an oncologist. So I have a lot of people that get a lot of doom and gloom, and then we change things up and they do better.
Yeah, when you have animals that, I know there's no one answer, but when they have cancer and you treat them, I want to ask you what the treatments are, but do they tend to live just longer than they normally would have, or they live until they normally would live anyway, their normal lifespan?
Well, sometimes it's, one, both, or neither. Every case is definitely different. And I'm not saying that, integrative medicine has cures for cancer, but I am definitely aware that when we combine therapies, or if, people are trying to avoid doing chemo for, one reason or another, or they can't do surgery because the animal can't tolerate anesthesia, all of those things, we still have answers that improve health and longevity in integrative medicine. And that can, those things, that what I see is I've had animals come to me for a whole bunch of different cancers. Let me just think if I can think of a couple of cases. Like I've had osteosarcoma. So, for example, osteosarcoma, it's bone cancer. It's really bad. It'll be in one of the long bones, typically in a lot of dogs. So, large breed dogs get that. And what the oncology, general guidelines are is you have to take the tumor off, would you amputate a leg, and then you have to do chemotherapy, radiation, depending on, what they find, because It's already in the bloodstream. They assume that once it's in the bone, it's going to be in the bloodstream. You're going to see it again. It's going to metastasize somewhere or whatever. Yeah. And the fact for me, and they'll give a timeline. They'll say, okay, you've had osteosarcoma in a bone. This dog is really not likely to live more than a year. That's going to be their best case scenario with chemotherapy, with taking the leg off, depending on the type of thing. That is not what I see in my practice. I see animals, it's after they remove the leg, we get rid of the source of the pain, and then we do all of our therapies. We'll do things like for cancers, it includes, the diet change to avoid carcinogens, so no processed foods, very fresh foods. And then we, avoid things like we're going to be avoiding vaccination, we're going to be avoiding different types of pesticides, and then we're also going to give therapies that help the body with its immune system. So you're going to want to support a very healthy immune system. And the way to support an immune system is, we'll use mushrooms, we'll use different types of adaptogens like ashwagandha, and different supplements, and then different supplements to help the body in general to stay very, very healthy in terms of omega-3s, your fatty acid profile, depending on the type of cancer B vitamin, things like that. And we do all of that, and then it's like 3-4 years later, I'm still dealing with that pet. And the owners can't believe it. I've had an owner come in with a liver tumor. He came in and he said the oncologist gave him, I think, something like 6 or 8 weeks. He said, this, the dog is in really bad shape. And I'm like, I get it. This is terrible. So there wasn't a chemotherapy. There was no surgery. There was nothing they could do. I was like, okay, well, the dog seemed very bright and alert to me. So we did all of the things I've just mentioned, basically, diet change. And then in addition, we did a ton of things to help the liver. I mean, the liver is an organ that's amazing. And so we did, Denicil, which is SAMI. We did milk thistle. We did really, good omegas. We did curcumin, and we did mushrooms and, that kind of thing. This dog, every few months he would call me up and say, I'm planning a trip to Colorado. Do you think I should plan for the dog to come with me, or do you think she's not going to make it? I'm like, well, plan the trip, bring her with, And then again, it was like 3 years later, the dog had been to Colorado 15 times, camping and hiking in the mountains. And, awesome. It just got to be the joke. Like, are you planning a trip? The dog can go. But that's not, it's just more common sense and doing your best. And, I've definitely had cases where they've come in with cancer and we've done everything we can do, and then they die of cancer soon. It happens. But, it's nice to know that if you have a chance, we're giving the animal every chance to heal itself. And that's where if you've tried, the few things you can with conventional medicine, it is nice to have some alternative options, just knowing that you've incorporated everything that makes sense. If you're sort of relying on just one thing, I feel like that makes people feel very frustrated and helpless. It's nice to know you've really gone down all of the avenues you can go down, and having someone that thinks about all of those options, or if I don't know about it, I find someone who does, and we combine those therapies. That's my job. Make sure we've got it the best of the best, and give them the best chance to heal.
Well, very good. Not everyone can come to you, unfortunately. So what do people do if they live in other cities and states and or countries, and they have sick animals, or they want to optimize their animals' health? What do they look for?
Well, there's a lot of different organizations that teach holistic practitioners, and they have varying degrees of expertise. But in this country, the American Holistic Veterinary Medical Association has a sort of find a vet part of their website. So that's one place to go. I used to be the president of that organization. I think they do a really good job. Then there's other organizations like the International Veterinary Acupuncture Society, and that's in many different countries. So that one, has, if you can find a veterinary acupuncturist, you can look, it's IVAS. I think it's evaluations.It. I think that's who they are. And then, there's, if you look up the type of therapy you think you might be looking for in a veterinarian, and see if they do that, if they do chiropractic, or if they do nutrition, consults and things. I would say that, it's the idea of a board certified nutritionist or somebody who is classically trained, in nutrition with a PhD, it's not that they're necessarily wrong. I just don't know if they're really holistic. So you're looking for someone who's holistic, who's doing that. If you're looking for alternatives, if you want just the conventional wisdom on nutrition, then that's going to be a little bit of a different place. So you're going to want to look for somebody who is holistic, who is training in nutrition, because a lot of the nutrition programs are funded really by the big companies and the multi-billion-dollar industry that's got a little bit of a stranglehold on what people learn about nutrition. So, just trying to be careful and aware. But you can find people, you can do that. And then I'm with the Royal Animal Health University, I am actively teaching pre-veterinary students. I'm an adjunct professor at Cal Poly for their pre-vet program. So there's going to be more vets coming out doing this. And then we're teaching veterinarians, we're teaching technicians, we're teaching pet owners. These classes in keeping your animals healthy are available worldwide through the Royal Animal Health University. So if anyone wants to, look at the Royal Animal Health University website, they can take different classes in animal health care. If it's a veterinarian, they can learn and get certified in our program. So we're going to be seeing more veterinarians out there using these integrative techniques, because I feel it's my duty to teach it and say, this has worked for us. Come on, we can do this. So
that's really great.
And I have a book out, the Royal Treatment. We have the natural approach to wildly healthy pets. So that one's on Amazon and wherever. That's one people can buy. That gives some hints as well to help people guide themselves. So things like that.
Well, that's great. It's been awesome having you, and I'm really glad that you're doing this. And I just so many, and not even parallels to people. It is for people too, and for their animals. So I hope people make this journey, and I hope they take their animals with them, or vice versa. The animals take them on this health journey. So thanks so much for being on the podcast.
You're very welcome. It was a pleasure. Thanks so much.
You have been listening to Almost Here, Around the Corner Future Technology podcast with Richard Jacobs. Subscribe to this podcast, post a review to discover more future technologies that are poised to transform our lives for better or worse, such as Bitcoin, artificial intelligence, 3D printing, blockchain, virtual reality, and more.